Okay, so now we focus again. This is the first one, rounder. Or second? The first one, okay. So this is the first one, rounder, the shape, or second? First? Second? Second one, okay. So now this is the first one, rounder, the shape, or second? Second, okay. So the first one, rounder, or second? First one. The first one better, okay. So now the first one, rounder, or second? First? Second? It's about the same. This is the first one. And second, how about same? Huh? Okay. So now you focus on the the black dots, huh? So this is the first one, the dots clearer, or number two? 1, 2. It's same. Same. This is 1. This is 2. Same, huh? Same. Okay. So can you try to read this out? What is this alphabet? R-H-O-Z. Okay, and how about this? A-T-P-R. Okay, good. And how about now? Z-F-E-H. Okay, and how about this one? Cannot really. Cannot. Okay. So can you try to read this out? Differentiate it. Number 5. The red number 5 better or the green number 5? Yes. About the same. No different, eh? About the same. Okay. So any different? Is it this one? You can see it. Okay, because you see this one. I can see because this one. Can you see it now? Got one hole. Can you see the one hole there? No. Okay. Any improvement with this one? No, there's no any improvement. Okay. So if this one, any improvement? Without is better. Without is better. With is no improvement. Eh? Okay. So now and all right. So now you can try to see. Read it out. Can you see? Yes. Okay. Try to read it out. Okay, good. And how about now? This one, can you see? Yes. Okay, good. And how about this one? How about now? Okay, that's all you can see. Yeah. Z for that. Okay. So now you just focus on this one. Okay. So these 5 alphabets, then you compare. When I put it on, better or without? Again, when I put it on, without, with, without. No different. Different. Okay. Okay. So any different now? When I put it on, better or without? With, without. Without better. Okay, good. So this is one. Okay, so how about now? Number 5. The red number 5 better, clearer on the green one, number 5? No different, the same, huh? Okay, so and can you see this one? So focus on the O, huh? Let's see the O. So this is number 1, O, rounder, or number 2? 1, 2. Number 2, okay. So number 1, rounder, the shape, or number 2? Number 1, okay. Okay, so this is 1, rounder, O, or 2? Number 2, okay. So this is number one rounder or two? One, no, two better. Okay, so one rounder or two? One, two, two. Okay. And now focus on the black dots. Okay, so look at the black dots again. So this is number one, the dots clearer or two? One, two, no. Okay, so now, so this is number one, better, clearer, the black dots or two? One. I think it's not clearly. No different, two also blur. Again, one, two, one, number one, two blur. Okay. So, and can you try to read this out? What is this alphabet? A, E, R. Okay, good. And how about now? Still can read? Totally cannot read or slightly can read whatever you can see? I can see the shape. Okay, so that means the whole row cannot see. You can see the shape only, yeah? Okay, so now, how about this one? Number five, the red one, number five better or the green one? Both same, no different. Okay. So now, and any different when I put it on? Okay, then you see this one. Okay, so this one you can see the hole there. Okay, is that clear? Not clear. Not clear. So if I take it out, much clearer. Okay, good. So everything and for both eyes, can you try to read this out clearly? Mhm. Okay, and how about this one? Okay, try to read this out. That's all. HOA. Okay. Okay, and then for this one, everything. Okay. And you see here all the alphabets, right? For this one. Okay, so any different when I put it on? Okay, now it's still okay. For the first row, second row, you can see. Okay, when I put it on, the first row, what do you think? Can see? Or blur totally? Can still read it out or cannot? I can see. Can read, but it's not really clear. Huh? Yeah. Okay, so now any different? Huh? Okay, so look at this.
Winnie, can you see? Very far away. Winnie, can you hear me? Winnie, I can't hear you. Even now also I cannot hear you. You are mute. You are muted. I can't hear you. Unmute your phone. I can't hear you. Unmute your phone. You unmute first before you talk. I can't hear anything. Click, click, click. Click the speaker. Click the mic. I can't hear you.
So can you hear me now?
After you start do Ofta, like I can't hear anything. I keep talking and then
Oh
you
no.
and then I texted you also because I can't hear you.
Yeah, I didn't see phone at all.
Ah,
God.
okay. Next time you just need to keep an eye on your phone, see whether all okay or not.
Yeah,
Okay,
I keep
because
an eye to see whether can see my patient and see the view everything only. But
yeah, because
I already
I
lost
think
it
I think
about
your
the
one
voice.
phone died, is it? Your phone
Yeah,
another
the
you
one phone suddenly now I only realized that because just now before install the bug everything is still okay. I can see you are there.
yeah, after you start Oftal, then suddenly like everything is become very quiet. Then I thought you were very quiet. Then I saw you talking to patient, but I can't hear.
Yeah, but my iPad I didn't touch it anything, but I think it's okay.
It's okay. It's okay. It happens, technical
So
error.
sorry, so sorry for that.
Okay. Can you brief the second case because it's already time's up. It's up to 12
Yeah,
o'clock.
yeah,
Can you
yeah.
brief the
Okay.
second case?
Yeah, I just
First
quickly
patient, I still
quickly
was listening, but second patient,
yeah. Okay, so for this patient,
how old
because
is the patient?
yeah, she's complained about the glaring and then driving at night, even though sunlight too strong. She also
How
like
old is she?
so for my assessment, everything I already checked using the ophthalmo. I feel
How
like
old is
this
she? How
now
old?
25,
25. Working?
working admin assistant.
Okay. So she has glary problem
Yes,
at night while driving. What else? What
yeah,
else?
and daytime also sunlight is too strong. Then she also feel like glaring.
She's
Okay,
wearing glasses.
yes, spectacle
Okay.
wearer. Okay,
Okay. Any other
then
complaints?
sorry again.
You just answer my question easier. Okay. Any other complaints that she has?
Okay, then so far anything ocular history so far don't have, and then just normal, and then don't have any body checkup before. Okay, so using
Okay.
sometimes
Based
using
on the assessment, what is the finding that is why
okay
she's having glare problem? Based on your
yeah
assessment finding, why she's
okay
having glare problem?
for my assessment everything the finding for ophthalmoscopy, right? Okay, the internal I only can see because I'm not familiar with that, to
Mm.
be honest. So I can see the artery and the vein, but just a while. Then after that become blur. So this
Mm.
is like misuse of the handphone gadget something. So that's why it keep on like just. I ask the patient to keep on blinking. Then blink already is clear. Then after that it will become blur back. Yeah, so that's
Okay.
why I cannot see more details on that. Then
Okay.
after
Never
that,
mind. Okay. Based on the VA and refraction, do
yes.
you can you find out the reason why she's having the glare problem? Is there anything related to the refraction?
So for VA, okay, VA for right side 67.5 actually is
Mm.
quite good, and then for the left eye the VA was 69. Cannot get
Okay.
it.
So after
Yeah,
correction also like that.
yes, after correction.
She's a glasses wearer.
Yes, glasses wearer.
How much
So
is her power?
how much is the power?
Range
Okay,
in.
so after reflection, subtractive. So right eyes 325 and astig
Mm.
75, and left eyes 375 don't have any astig.
Okay, but then still vision cannot be improved. Okay, did
Yes,
you
cannot.
ask her that all this while when she go check her eyes, right? She memang cannot read the last line, is it?
Yes, cannot read the last line.
So
Oh,
she's
can.
emblayu.
But when both eye open, she can read, but have to force a bit. 6 minus 7.5 plus 2. She
Okay,
can read.
what is the term for the condition that she's having?
Condition. Uh, what do you mean like condition?
What is the name of the problem that she's having when vision cannot be achieved, cannot achieve 6/6? No
Can you?
idea. Okay, amblyopia.
Oh, amblyopia. Okay.
Because her vision cannot be corrected up to 6.6. That means she had her refractive error since young, but since it wasn't corrected, at the right time, so she cannot read up to the 6.6 lah. Okay,
Yeah.
for, monocularly. So patient is actually amblyo patient lah. Okay, so now, okay, her current glasses, the lens condition is good or not? Any scratches? The coating all good or not?
So far, the coating, everything is okay.
Okay, so
Yeah.
what could be the
And
problem of her glare problem? What do you
because
think?
the current spec, the VA, right? The VA also the same.
Mm.
No, the old one, the old spec, 669 minus 1, worse than my current subjective
Okay.
power. So improve lah when you compare the previous one and my new one.
Okay. So is it because of uncorrected refractive error? That's why she's having glare problem?
Maybe. So that's why I asked her to use a new spec, change a new spec, and then after 1 month, then come to recheck again and follow up again. So is it the glaring everything will improve or what?
Mm-hmm. Okay. Okay. Is her current glasses a transition lens?
Just a clear lens.
Okay. Okay. So what you can actually suggest to her is, okay, her complaint is glare at night and also, I mean, glare all the time, lah, basically night and, day and time, day and night, she's having glare problem. Okay. So usually what we would advise is, obviously we correct, we give optimum power first, lah. Okay. Since there is an improvement in VA, so the first management is to prescribe RX, which you already advised her to change. Okay. Number 2 is when she complained of glare problem, right? Usually we will ask them to go for transition lenses. Okay, so whenever she's exposed with glare, right? Okay, that will cut off, the glare, the discomfort that she has. So that will be the best way of suggesting lenses, lah. Okay, and her complaint for glaring at night while driving. Okay, so that one usually, if let's say you have given them with optimum RX, right? Usually that can actually, resolve the problem, lah. Okay, but then we have to wait and see whether, that got resolved or not. Otherwise, we have to think of some other way, lah. Okay, memang kalau tak ada solution for this, then we have to say that, she has to, reduce the time of driving at night and all that. Okay, so she came in with the complaint of glare. So the solution is prescribe her full RX, then suggest her to have a transition lenses, okay, and then we review back lah, or ask her to come back if she has problem. Still having the problem after we prescribe the glasses. Kalau tak ada problem, tak payah lah. Okay.
Or it's not like follow up patient about 1 month and then see have any improvement. Oh
No, because we don't give her any therapy. We're prescribing her glasses. So when we ask them to come back, the TCA would be to come back again, would be based on the symptoms. Okay, tell her that we're going to prescribe these glasses, okay, with transition lenses, and we expect it to get, things should get better. If let's say something is not right, if you still feel blur, if you still, feel glary, if you still feel glary after wearing the glasses, you come back to us and then we will do. So in your TCA, you write, patient is advised to come back again if necessary or needed only. Otherwise, annual eye checkup. That's how you write it. Okay. So that's how you solve it lah.
Because I want to confirm, for amblyopia, is it normally occurs at one eye? But this one is both eye, you mean? Because 167.5 and then
It can be certain people, they only have one eye, which, their VA is not up to 6.6. The other eye is 6.6. Can be also. It can be some people, both eye also. Right eye also like that, left eye also like that. Okay, some people, right eye, left eye, both eye also, cannot be corrected up to 6.6. So it depends, but all these similar, diagnosis only.
Oh, so this one is considered the category of amblyopia. Cannot say it's called considered category amblyopia, that's all.
Yes. So that's how you diagnose the patient lah. But no therapy can be given now lah. So we do have therapy for this, how to actually, make the patient read to the best line. But now it's over the age lah. She's already 20 plus, cannot do anything lah. If let's say she's still, schooling days or what, primary school and all that, we can give therapy so that the vision can be pushed to, to grow until 6.6. But now it is too late lah. So just tell her that it's too late. You have to live with it. Just that, you know, we will give you correction so that the maximum, you know, line can be read. Okay, and then you just advise her to come back if, let's say, it's still blurry or glary, sorry, you know, after wearing the new glasses.
Okay, so
Mm.
because for this patient, just now I advised the patient also 20-20-20 rule because
Mm.
she also, I asked her finally, then she said that actually I'm using phone is quite long time at night. So using the ophthalmoscopy, then I really just keep on blinking, can see a while, then later on gone. So
Mm.
that's the patient also. That's why then for the planning, the assessment and plan, so I will write it down also, right?
Yeah, write it down the way that we discussed lah.
Mm-hmm.
Okay. Okay.
Okay.
So what
Thank
you do is you submit. Okay. You submit the forms. Okay, the link for this video I will give it on next week. Okay,
you.
so you submit the forms. Once you already submit the forms, okay, the
Okay.
recording forms and all that, you WhatsApp me. Okay, so you WhatsApp me, say that Miss, I already submitted, then I'll go and mark. So I don't want be checking every day lah. Once you send, then I'll straight go to your folder and then I'll check and mark and I'll settle it there and there. Okay, so you just let me know lah. Okay, I'm sure you need time to, you know, complete your reports and all that. So once you already upload, you let me know. Is that
Okay, sure.
okay?
Yeah.
Okay,
Okay.
yeah. Okay.
Thank you. Thank
Uh, welcome. Okay, just need to be uh more bold. Okay, the way you communicate with your patient is very good lah. I mean, you can talk. Just that need to be a bit more, show some confidence on the face while you're instructing. Your patient doesn't know whether you know or don't know. Okay,
you.
but your confidence should be there so that they will trust you and, you know, uh cooperate with you more lah, with more confidence. Okay,
Yeah.
otherwise it's all good.
I want somebody actually the ophthalmoscopy in
Hmm.
internal actually I keep on trying, but as I can see
It's
any
okay.
the optic disc I really need a lot of
No, no,
time.
no. What you do is you try with someone, not patient lah, because when patient, right, you feel nervous. You
Yes.
try on your friends, your, you know, your working place, right? You try on your, you know, colleagues first. Okay,
Mm.
try, you know, when you go closer, you know, because just now you were further away, you know, I was actually telling, okay, Winnie, go closer a bit for Ofta, go closer, but you cannot hear me.
Yeah.
Okay,
Then
you
I'm
need to be,
quite close. Then
it has
fine.
to be close, even more close. Then only you will be able to, yes. So I keep telling you, but you no reaction. I'm like, is she listening or not?
So
Okay,
that's why.
so you
Uh,
try on your colleagues, okay, while you have no customer and all that, right? Try on them. So make sure that, you know, when you try more, when you practice more, when you already can see, right, then you see at what angle, how do you position your optal, okay, that make you to see. So the same thing you repeat with another person. So when you already know, oh, when I put my retinoscopy like this, at this power range, okay, at with this illumination, this angle, this closeness, I can see the optic disc. Apply the same thing to another person. Okay, then only become a habit and it's easier for you.
so optic disc normally will nearer to the nasal part, right? Normally, the position roughly.
Temporal,
Or
temporal.
temp
Yes.
is not nasal part.
No, no, no. That's why, okay, the easiest way is, okay, when you stand straight, right? Okay, you stand like, you know, 1 meter or 2 meter away from the patient. Okay. So once you already, you know, 1 meter, then what you do is you take, you know, this is your leg. Okay.
Mm.
You take one step to the side. Okay. Then you move close and then you do optal. For sure, the first thing they will see is you will see optic disc.
Look straight, can see the
Yes.
optic.
That means you, like you are, you know, in front of me. Okay. My leg is like this. I'm straight to you.
Yes.
Okay. So what
Mm.
I do is before I move closer, I'll take my one leg like this, then I follow. Okay,
Mm.
already to one side. Then I move straight to your eyes. Then you will see the optic disc. One
Temporal.
step. Yes. No, 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 no.
That means side lah. That means okay, my eyes. So you'll be here, right? You'll be
Yes.
here. You'll be here. Because normally I find here. So
No, no,
don't
no,
find.
no, no, no. What you find is correct. Yes, you will see, like you will see at the nasal there.
So I look straight forwards and I can see really.
Yes, yes.
Okay.
You will be seeing at the nasal. Yes, your focus will be like this, nasal to the nasal.
To the nasal. So I'm standing here. Okay. I'm
Yeah.
standing here and I'm the patient and
Yes, correct.
saying it again.
Ah,
Okay.
yes. Cannot be straight. That's why I say when you stand in front of the patient, you take one step, then you
Mm-hmm.
go straight to the, I mean, from that angle, you go straight to the eye. For sure, you will see you an optic disc.
Okay. So this is like because you go side, this side like my eye here, then you go side.
Yes, correct.
Yeah.
Correct. Yes. Then you go straight, then you will see.
Okay.
Okay,
Okay.
but it takes practice lah. You practice always because you don't know how, because there's a lot of things. One, you want to see. Another thing, you want to adjust the power. So it's a lot of confusion, but don't worry. I also started like this when I was student, but now I can do very easily because I do many times. Okay,
Yeah.
so give yourself time, practice more, try on your friends and all that, then you will get used to it.
Yeah. I
It's
can
not
see
something, it's
when
not something very big that you need to worry about. Oh, I cannot do this. No. By the time you graduate, you will be very fine with this.
I hope so. This one.
Okay?
Okay.
Okay,
Okay.
yeah? Okay, once you submit, you WhatsApp me.
Yeah. I will
Okay?
let you know.
Okay? Okay,
Okay. Thank
bye, Winnie. See you.
you. Thank you.
Bye.